Yes.
Okay, so our presentation is on muscle spindle, and it's going to be presented by Jordan and I. This is our table of contents. We're going to start with an introduction on what muscle spindle is, followed by the function and the different types of fibers that are found in the muscle spindles. We're gonna go into sensory innervation, give you an example, and describe the muscle spindle composition. We're going to look over the normal versus abnormal anatomy and the clinical significance, as well as the recent findings and therapeutic strategies for when the muscle spindles are damaged. So muscle spindles are small encapsulated proprioceptive sense receptors that inform the central nervous system about changes in the length of the muscles. So with this information, the CNS computes the position and movement of our extremities in space, which is a requirement for motor control, as well as for maintaining posture and a stable gait. The responses of muscle spindles to changes in length will play an important role in regulating the contraction of our muscles, and it does this by activating motor neurons via the stretch reflex to resist muscle stretch. Since it is a proprioceptor, it's going to sense the stretch and the speed of the stretch, and it's also going to detect the position and movement, as well as protect us from overstretching and overcontracting. It's going to initiate reflexes and prevent damage, and it's the most frequently found sense organ in skeletal muscles, and it is present in almost every muscle that we have, and it is the most important proprioceptor, as well as there are approximately 50,000 muscle spindles in the entire body. So what is the function of a muscle spindle? So when a muscle spindle associated muscle is rapidly stretched, it can cause two things to happen. So the muscle spindles are known as stretch detectors, and they're going to sense how much and how fast a muscle is lengthened or shortened. So when a muscle is stretched, this change is transmitted to the spindles and their intrafusal fibers, which are subsequently similarly stretched. It may signal its muscle to contract to prevent it from going too far quickly, i.e., overstretching. The stimulation of a reflexive muscle contraction is known as the muscle stretch or mitotic reflex. It's going to prevent it from contracting so that it can't contribute to any further stretching. The sensory innervation of the muscle spindle arises from both the LA and group 1A and group 2 afferent muscle fibers. So as you can see on your screen, that is a muscle that is stretched versus when it's relaxed versus when it's contracted. So I'm going to go into the different types of muscle spindle fibers. So there are three different types, and they're going to be characterized by their shape, as well as the type of information they're going to convey. The first are nuclear chain fibers, and they're named because their nuclei are aligned in a single row or chain in the center of the fiber, and they're going to send signal information about the static length of the muscle. The second is the static nuclear back fibers, and these are named because their nuclei are collected in a bundle in the middle of the fiber. Like the nuclear chain fiber, these fibers will signal information about the static length of a muscle. The third is dynamic nuclear bag fibers. These fibers are anatomically similar to the static nuclear bag fibers, but they signal primarily information about the rate of change or velocity of the muscle length. A typical muscle spindle will be composed of one dynamic nuclear bag, one static nuclear bag, and 5 nuclear chain fibers. And as you can see on your screen, there is a picture of what a dynamic nuclear bag looks like, as well as a static nuclear bag fiber and a nuclear chain fiber. Sensory innervation of muscle spindles. So how exactly do the muscle spindles work? So the muscle spindle signals muscle length and velocity to the CNS through two types of specialized sensory fibers that will innervate the intrafusal fibers. These sensory fibers have stretch receptors that will open and close as a function of the length of intrafusal fiber. Group 1A afferent are also known as the primary afferents. They will wrap around the central portion of all three types of intrafusal fibers that I talked about. And these specialized endings are called annulospiral endings because they innervate all three types of intrafusal fibers. Group 1A afferent provides information about both the length and velocity. Group 2 afferents are also known as the secondary afferents, and they're going to innervate the ends of the nuclear chain fibers and the static nuclear bag fibers at specialized junctions. And these specialized junctions are called flower spray endings. Group 2 afferent fibers will signal information about muscle length only. They do not innervate the dynamic nuclear bag because the muscle spindle is located in parallel with the extrafusal fibers. So this is an example of a muscle spindle in work, as Noah and Arissa talked about. A knee-jerk reaction is an example. So a simple tap on your knee, which is known as the patellar reflex, will cause the sudden kicking movement of the lower leg, and that is in response to, as I said, the toe being tapped on your leg, which lies just below the kneecap. Tapping on the tendon of the knee extensor muscle group below the patella will stretch the muscle spindle fibers. This is going to cause activation of extrafusal muscle fibers in the same muscle. A knee jerk will occur as these fibers actively shorten, and this in turn shortens the intrafusal fibers and causes their discharge to cease. I will now pass it on to Jordan, who will be talking about muscle spindle composition.
Thank you, Louisa. So the muscle spindle composition is a collection of 68 specialized muscle fibers that Louisa has just gone over, and they are located within the muscle mass. It is composed of intrafusal fibers that are located within the extrafusal fibers of the skeletal muscle, and almost every muscle contains muscle spindles. The spindle is composed of the specialized muscle fibers, intrafusal fibers, and they're innervated in the proprioceptive sensory neuron, so that just tells you where you are within space. This is what the muscle spindles help you to detect. Now we're going to be going over the normal and abnormal anatomy. So this is muscle spindles in DMD patients, so muscular dystrophy patients, compared to normal, and they're analyzing the muscle spindles within mice. So studies in humans and mice with muscular dystrophy show various degrees of impairment of muscle spindle function and proprioception. The deficits could alter joint coordination and impair movements and contribute to unstable gait, frequent falls, and motor control problems of muscular dystrophy patients. So panel A shows intrafusal fibers labeled with the anti-dystrophin antibodies, which is the red that you're going to be seeing. And it's against the vesicular glutamate transporter, which is the VGLUT1 white channel. These white marks you see here is the VGLUT1 white channels. Panels B through D show just a higher magnification of panel C. And panels E through J show the distribution of utrophin, which is an analog of dystrophin. It's an essential region of the muscle spindles from wild type, which is these as wild type is E, F, and G. And the DMD, the muscular dystrophy mice, are H, I, and J. So the green is what is the anti-gamma GLUT1 antibodies, and these were used to label the sensory nerve terminals, so the green that you see in E through J. And panels D, G, and J show merged channels of the combination of the anti-GLUT1 and the utrophin. The utrophin is not detectable in the equilateral region of muscle fibers from wild-type mice, but they are severely upregulated in the intrafusal fibers of the DMD mice, which you're going to see in H. So again, that red is the utrophin. And utrophin accumulates in muscle spindles the same way that dystrophin would, as it is an analog, as I mentioned earlier, which is why they're using this as a comparison. And panel K shows a single confocal section of the muscle spindle stained with antibodies against the GLUT1, which is magenta color, and against the dystrobrevin, which is green. Dystrophin is absent in intrafusal fibers of DMD mice, as you can see in for E through G. So E through G, the dystrophin is absent. And however, the utrophin expression is markedly upregulated and has a similar distribution to DMD mice as a dystrophin and wild-type mice would. So that's what they accumulated from the study, that the intrafusal fibers are somewhat protected and don't show as much degradation due to the distribution of the dystrophin in the muscle spindle. Do I want to change? Okay. Okay, now we're going to go over the significance. So, muscle spindles alert the brain that nearby joints and soft tissues are in danger of being stretched too far, which is what I was saying, proprioception. The spindles thus indicate the degree to which the muscle must be activated in order to overcome a given resistance. As a load increases, the muscle is stretched to a greater extent, and engagement of the muscle spindle results in a greater activation of the muscle. Muscles that perform the precise movements have many spindles per unit of mass to help ensure the exact control of their contractile activity. And here on the right, you're just looking at muscle spindle development starting in the embryonic stage, and it continues on to adult life. Human muscle spindles can be recognized in fetal tissue around 11 weeks of gestation. So this is as gestation increases in time, the muscle spindle concentration is increasing as well. Okay. So recent findings show that the proprioceptive system and specifically muscle spindles play vital regulatory roles in skeletal development and function. These findings suggest that spindle pathology would have a broad effect on the musculoskeletal system, highlighting the importance of uncovering the molecular composition of muscle spindle. So some therapeutic strategies that they're going to be targeting is to aim at increasing muscle strength, reducing muscle fatigue and degeneration, and to preserve the muscle spindles and the sensitization of proprioception in order to maintain appropriate motor control and stable gait and posture. And this is what I was talking about with the normal versus abnormal anatomy when it comes to patients with DMD or suffering from muscular dystrophy. This is what they're going to try and target as a therapeutic strategy with muscle spindles. So they're going to be using a drug right now called Piezo-2, and it channels the primary mechanotransduction channel. It might be exploited to develop drugs which specifically target mechanosensitivity, interfering with extrafusal muscle fiber function or with neuromuscular transmission. This drug either directly affects the Piezo channel or it indirectly, for example, via GI-coupled receptors. And these are our references.
Okay. Let the reference 1 second, please. Okay, questions, please. No questions? Okay, so let's see. I have a question. Of course, you mentioned several times dystrophin. What is the dystrophin?
Dystrophin is what you're going to be seeing in patients that are experiencing muscular dystrophy. It's the protein.
It's a protein, okay. And it's going to be controlled by a gene? It's not controlled by a gene?
I just know about the DGC.
Okay, to try to find out this, I'm sure there's a gene that is going to be controlling the dystrophin proteins that sometimes lack or missing in some patients. In that case, what type of disorders is going to be present?
In absence of dystrophin?
Yeah, exactly.
DMD?
Exactly. Muscle dystrophy.
It's the dystrophin gene that produces dystrophin.
Exactly. Yes, exactly. That's why I mentioned to you that you have to have clear this. And one of the most important muscle dystrophy is going to be the that the patient died in early age. The Duchenne disease. Duchenne disease. Okay, very good. Excellent.
Thank
Next
you.
one.